Demonstration 2. Child CPR. The deterioration of this child has been anticipated. Therefore, the appropriate aerosol generating procedure, PPE, has already been donned. Gloves, gown, eye protection, FFP3 mask. Always make sure it's safe to approach. Check for danger, look for obvious hazards. Gently stimulate the child and check for a response. If the child does not respond, shout for help and pull the emergency bell if one is available. Open the airway. Make sure the child's airway is clear. Check for obvious obstruction. Place the head in the sniffing the morning air position using a head tilt chin lift manoeuvre. Look for absence of normal breathing, taking no longer than 10 seconds. Do not put your face near the child's face to listen, feel for breath. In hospital, help should be readily available, and so instructions should be given to the helper to call 2222 for the paediatric resuscitation team, stating the exact location.
Thank you.
Paediatrics resuscitation team, Ward 16, ground floor.
If the child is not breathing normally, give 5 rescue breaths using the bag valve mask device with 15 litres of high flow oxygen attached, with an inspiration time of about 1 second. Ensure good chest movement. Check for signs of circulation or signs of life, taking no longer than 10 seconds. This includes purposeful movement, coughing or normal breathing. If trained to do so, check for the central pulse. In the child, this is the carotid pulse. If there are no signs of circulation, start chest compressions. The landmark for chest compressions is 1 finger's breadth above the xiphisternum. For the child, compress the chest to a depth of 5 centimetres at a rate of 100 to 120 compressions per minute, using the heel of 1 or 2 hands, as required to perform effective compressions. Continue CPR at a ratio of 15 compressions to 2 breaths. It is important to change the person doing chest compressions at least every 2 minutes to avoid fatigue. Having established effective CPR, the defibrillation pads should be attached to the child in order to assess the rhythm. The paediatric ALS algorithm should then be followed as appropriate. It is important to remember your personal protective equipment. Follow the current local and Resuscitation Council UK guidelines for current PPE requirements for resuscitation attempts.